This portion of the course on veterinary dental radiographic interpretation will center around the radiographic diagnosis of endodontic disease and clinical applications that are associated with that. You take a look at this image and you'll see this incisor has some evidence of fracture and or wear. And anytime that we have exposure of the dentin, we have a potential for endodontic disease to occur. And the mechanism by which that occurs is commonly known, and I'm sure many of you have been exposed to this previously, where dentin, although it appears to be impervious, is not. Multiple little canals traverse from the odontoblastic layer, which lines the pulp cavity, into the external dentin enamel interface. And when that interface is compromised, the dentin's exposed, and the oral bacteria have a chance to get into the pulp cavity, consequently cause pulpitis and or pulp death, and classically signs of endodontic disease will show up radiographically over time if that occurs. So in this example, if we're able to take a probe and place down into that defect where the hole is that you can see here, and it goes into the canal, we have either a dead or a dying tooth, and the radiographic changes are going to be characteristic depending on how long that's been present and how old the patient is, and possibly some other factors as well. So looking at this from a radiographic standpoint, many times what we'll find is that there will be a lucency that surrounds the apex of that tooth, where the byproducts of pulp necrosis and also in many cases bacteria are able to access this periapical bone by the little apical delta canals that are at the end of this apex and reach out into this hard tissue and destroy it over time. In this patient, we've got more severe wear. This is a middle-aged dog that had access to many different things over its lifetime and has very contiguously worn all four canine teeth. You can see here, looking at the coronal to apical view, that there's a black defect where the pulp cavity is, and you can actually take a probe, place into that defect, and go right into the pulp cavity on this tooth. So there's no doubt that that's a dead tooth. The owner had recognized that this had been going on for many years, so this is a long-standing defect on all four counts, and certainly some other wear on the other teeth as well. But radiographically, what we see here again is a very distinct lucency surrounding the apex of this tooth. And if you also notice, the pulp cavity diameter is very large compared to the pulp cavity diameter of the adjacent premolars, and you also have a direct communication with the pulp cavity and the very apical portion of the root tip or the apex. There is no stop here. It just continues on without any dense dentin formation here at the root tip like we normally see, as we see here and here and here. So that is another manifestation of the age of this patient, when that tooth died, and the extravasation of all of that material into that periapical space. We look at the maxillary canine on the left side, the same patient. We've got an even larger pulp cavity diameter here, and certainly a problem in this patient as far as extractions go.